Americans from job lock, a Republican health care priority for years until it became associated with a guy named President Obama.
Capitol Hill is buzzing over a new nonpartisan report.
One sentence dominated the coverage of the report.
Policies, especially the president's health care law, are discouraging work. Washington is making this problem worse.
That it could be a tad bit misleading.
When one misinterpretation gets out of the box early, it takes the truth an awful long time to catch up.
There's plenty of 30-second ads to be drawn out of this, and that's why Republicans are so giddy.
Fewer people are going to be working, and the economy will be slower as a result.
Democrats are pushing back in a big way.
There's a big difference in losing a job and leaving a job.
This isn't employers cutting jobs.
More Americans will be able to voluntarily choose to work fewer hours.
All this disaster put out on the airwaves is simply fear money.
We are very concerned about the impact that the president's health care law is having.
Bad man.
CBO Director Douglas Elmendorf directly refuted the claim that the ACA is one gigantic job suck.
We think that people leaving the labor, choosing not to work because of the incentives provided by the Affordable Care Act would have essentially no effect on the unemployment rate. We said that very clearly in our report.
What the CBO actually concluded is that many workers will choose to withdraw from the labor force, not because employers will hire less, but because many low-income workers and those close to retirement will no longer experience something called job lock. That's where they feel compelled to stay in a job in order to keep their health insurance. So once you read the fine print, or the actual print for that matter, getting freed from job lock is not exactly a terrible thing.
It allows Americans to choose to spend more time with their family or pursue their dreams, and that is not a bad thing. It's a good thing.
This isn't employers cutting jobs. It's newly empowered workers choosing to go a different path.
In fact, freeing Americans from job lock, this is the very thing that conservatives, including a guy named Paul Ryan, have been calling for. This is Paul Ryan in the year 2009.
The key question that ought to be addressed in any health care reform legislation is, are we going to continue job lock, or are we going to allow individuals more choice and portability to fit the 21st century workforce?
Job lock, the key question. Paul Ryan, a man who is very, very popular in his party. But reality bites. Instead of acknowledging that his key question had been answered by the president's health care plan, Paul Ryan pivoted to his new favorite subject, poverty.
These changes, they disproportionately affect low-wage workers. Translation, Washington is making the poverty trap much worse in inducing a person not to work who's on the low-income scale, not to get on the ladder of life, to begin working, getting the dignity of work, getting more opportunities, rising their income, joining the middle class. This means fewer people will do that. That's why I'm troubled by this.
Despite Paul Ryan's newfound concern for the poor, the CBO director made clear that the law is actually helping low-income Americans.
These subsidies, of course, make those lower income people better off. This is an implicit tax, not the sort of tax we normally think about, where if the government raises our taxes, we are worse off and face a disincentive to work more.
Yeah.
By providing a subsidy, these people are better off, but they do have less of an incentive to work.
So I understand
they will respond to that by working.
I guess I understand the better off in the context of health care.
Consider that begrudging acceptance that the ACA might do something good, but do not consider it a white flag waved in the ceaseless Republican battle against the nation's health care law, no matter how hypocritical that strategy may be.
There is no health care reform, left, right, or center, that doesn't involve subsidies. And when you have subsidies that decrease as earnings go up, you have this labor supply effect that the Congressional Budget Office documented. So it's endemic to any kind of plan you would have out there. And the key issue, as we've heard many people, including yourself, say about this, Alex, is it's a personal choice. This is an area where you have the same amount of labor demand but a little bit less labor supply. That actually means a tighter labor market. And by the way, one of the implications of this is slightly higher compensation.
Higher wages.
That came out of the CBO report as well.
From the 2008 John McCain health care plan under the section Breaking Job Lock. And I will read a quote from that. Under the McCain plan, which links tax breaks directly to individuals instead of to their place of work, individuals would no longer feel obligated to stay with their employers simply because they need to keep their employer-based health insurance. That is exactly what the Affordable Care Act does and what the CBO is, doubling down on effectively yesterday.
There's another element of the hypocrisy, too, I think is fascinating. It hasn't really been commented upon yet. This is the second fight we've had this year over workers leaving the labor force. The first one was last month when the big debate in Congress was whether or not to extend federal unemployment insurance. I think what's interesting is that most of the people leaving the labor force as a result of the Affordable Care Act seem to be doing so by choice, whereas in the case of federal unemployment insurance, you have people giving up out of frustration because they can't find a job. So one way to address this easily without repealing Obamacare would simply be to extend federal unemployment insurance so you could keep some of these people in the labor force. But the intellectually honest debate isn't always the one that takes place in Washington.
That's euphemistic. Jared,
go ahead. I'm sure that House Republicans will snap into action once they get Josh's argument there.